Hello and welcome to this special show on Rajya Sabha television. I am Vishal Dahiya, and here we take a stock of the battle against COVID-19 pandemic. Now today we're going to talk about a very important aspect here, and that is the transmission of COVID-19 through children, and also the fact as to how susceptible are children themselves to the COVID-19 infection. There are new information, which is coming in from new studies which have been carried out by various scientists. We'll try and understand the entire situation and also juxtapose the same on the Indian, context as well as to how things are going on here. For more on this, we're joined by a distinguished panel of guests. Let me first introduce the guest to you. First, Dr.Aparna Mukherjee, the scientist E at Clinical Trial and Health Systems Research Unit in ICMR, New Delhi. We are also joined by Dr. Lekha Bhatta, Assistant Professor in the Department of Epidemiology and Public Health in the Central University of Tamil Nadu. And Professor Jayashree is also with us, Chief of the Pediatric Intensive Care Unit, Advanced Pediatric Center, PGIMER, Chandigarh. Welcome all of you to Rajya Sabha television. Let me begin with you, Dr. Mukherjee, and let's start by understanding the entire situation vis-a-vis the transmission via children of COVID-19 as well as the susceptibility of children themselves to this particular infection.
Yes. So from the beginning of this pandemic, what was being thought was that children are kind of having a less severe manifestation of the disease in most cases, probably because of their already frequent encounters with viral infections, or maybe their receptor that is utilized by SARS-CoV-2 is less in their respiratory epithelium, their ability to regenerate the epithelium faster, and these kinds of reasons might have led to less severe manifestations. But it's not that children are not being affected. We are getting cases of pediatric SARS-CoV-2 too. So as of now, if you look into the national data, so we have about 8% cases which are less than 18 years of age, which we would call children. And amongst the death, it actually comprises a very small percentage of 1%.
Okay.
But as you were saying, that new studies are coming into light. So there's a very recent one in the Mortality and Morbidity Weekly Report, which is saying that in a household, if even the index case would mean that it's the first case which is identified as having the COVID-19 disease in the household, even if it's children or it's an adult, it doesn't matter. It's the same rate of transmission that is happening to the other household people.
Okay.
So to say that children are not spreaders, that children will not be able to transmit to other persons, that may not be correct. So if they have the disease, they will be able to transmit to other persons as well.
Okay. So that makes it pretty much clear that children are equally susceptible to the COVID-19 infection as the adults are also. Let me bring in Professor Jayashree here. Professor Jayashree, in your experience, the way you might have been, treating the younger patients and looking at the entire situation vis-a-vis the COVID-19 infection, how would you, summarize the entire situation here?
Yes, I would like to put across two scenarios here. The scenario one was what we saw in the early pandemic, and scenario two is what we saw when the pandemic peaked, that is somewhere late August and September.
Mm-hmm.
So in the early pandemic, when there was a lockdown which was announced, schools were closed. Obviously, the children were inside their homes, and the only contact that they had were the household contacts. So whatever infection children got was from adults. And as Aparna has already said, the disease in children is either asymptomatic, they will not show any symptoms, or if at all they show, then it will be mild symptoms in majority of the children. However, what we must remember is children who have some underlying illnesses, say for example, an underlying heart disease or a kidney ailment, which can happen in children also, there the COVID infection tends to be a little severe. They require hospitalization, they may have problems. So therefore, In the initial part of the pandemic, most of the disease in children was, I would say, even in our data in PGI, 60% of the children had either asymptomatic or mild infections. But now what we saw when the pandemic peaked in August and September, that the disease is not so innocuous like what we thought in the early pandemic. There were children who were coming with multiple complications. There were children who were like having underlying comorbidities who tended to become more sicker. So therefore, one has to remember that it may not be as mild or as innocuous as what we think. Because if we say so, then there is a element of complacency that tends to creep in. Therefore, we have to remember that children are affected from both ends. One, they themselves can be spreaders for the adults in the household, or they themselves can get the infection from the household contact. So in both ways, the children are a very important, I would say, chain in the, or the link in the chain of transmission which occurs in this virus.
Okay, definitely they do indeed remain a very important link in this entire chain of transmission. In both situations, the household conditions as well as outside environment as well. Let me bring in Dr. Lekha Bhatt here. Dr. Bhatt, your initial views on what we are learning now, and as Professor Jayashree and Dr. Mukherjee also pointed out in terms of what we knew around 6 months ago based on our experiences and new studies, new evidence coming in. Right now, it'll be safer to say that children are equally susceptible and they're equally, they can become the carriers of the virus as well.
Yes, yes, Vishal, as Dr. Muralidharan and Dr. Jayashree is pointing out, children can be carriers themselves and they can be infected also. So in both cases, the situation is going to be more severe, as there is proposal to the state governments to open up the schools in their areas, respective territories, depending upon the local conditions. Just to start with the study, in Indian context also, the study Madam was pointing out is a CDC study. Now in Indian context also, studies are coming up. Study published in Nature and Science recently shows that children are super carriers of this infection, because for them social distancing, maintaining protocol, making them aware and follow the protocols, it's all little difficult. So the study points out that it is done in Tamil Nadu and Andhra Pradesh, shows that children were 80% more chances of being carriers than the adults. And the sample size is also representative and quite huge sample size, and published in Science. So this is bringing in new dimension to the whole handling of this pandemic in our present context.
Okay.
And our children, till now, they are in a protected environment. As other two co-panelists have said, they are not attending schools, they are not allowed to attend public functions, public places are not accessible generally. So they are in a protected environment at home. And once the schools are reopened, or once they are accessing the public places and public avenues, the situation is going to be more critical, because NFHS data shows that our children, 59% are anemic in our country. Then some 28% of children are stunned. Many have underweight issues. And as Madam said, lot of comorbidities and other health issues are there. So coupled with these comorbidities and a weak immune system, when our children are going to be exposed to the environment, that outside environment, the situation will be a little more alarming. So we should be prepared to do more studies as well as handle the cases and other emergencies at required emergencies.
Okay, definitely. We'll get to know more the more we, learn about this particular virus and its behavior and its effect on several aspects, several segments of the society, including children as well. More studies will throw more light. But Dr. Mukherjee, taking the thread there from Dr. Bhatt's remarks, one thing which seemingly is pretty much clear here is that despite the fact that children have been confined to the house, their respective households, till the first 6 to 7 months of this particular pandemic, and that is based on that information. Now we're trying to understand as to how this virus behaves and how children are more susceptible to it. It becomes really more important. So what should be done in terms of formulating strategies to tackle this vulnerable section of the society, that's children?
Right. It's a very difficult situation in the sense that as long as they stay at home, you kind of have a control over them. But if once they are in school and outer place, particularly the younger ones, telling them to wear a mask and hand washing and to follow all those diligently, it's kind of a bit difficult. So therefore, we'll need to be very careful once we are thinking of opening up the school, particularly for the very young ones. The older kids, they can be responsible and they can have social distancing and masking and hand hygiene. We can make them understand. But if you have a primary school kid and they are getting to know their peers after so many days, and you really can't control them in that way, like can't tell them to be socially distant. So then we really have to be very careful when we are letting the kids out and mingle with their peers, so that it doesn't really become a spreading and alarming situation.
Okay. So these are some of the steps. Professor Jayashree, would you like to add up to this particular list out there and this scenario as well being really significant, because what everybody is talking about, all experts, all doctors, is that the pandemic fatigue which has started setting in, and the first casualty might be this particular section of the society, the children.
Yeah, I think that's it. Children are a very important part of the society, and we have already discussed many of the dimensions here. Now, one important aspect that we probably need to understand is that the younger children, I would say, like most hospital data shows that children who are less than 2 years, they are at risk for more serious infection with COVID.
Okay.
Yeah.
Now, having said this, we can always say that children less than 2 years are anyway not going to school. But I would, as a precautionary kind of a thing, say that children less than 5 years, I would rather put it that way, that children less than 5 years, that is the younger group, are the ones who are at high risk for developing serious form of infections. Though I don't want to sound like an alarmist. It's not that. I would still say that majority of the infections in children is mild or asymptomatic. But having said that, if we stratify them according to age, then younger children are at risk for getting complicated COVID infections. And as has been rightly pointed out by Dr. Mukherjee, even masking, if you read the guidelines for masking, it's very difficult to mask the children, especially the ones who are less than 3 years old. In fact, if you look at recommendations, it says that children less than 2 years, we should not be going for masks because it interferes with the way they breathe. Some tend to be mouth breathers. So by masking, you're going to create more problems for them. Again, maintaining social distance is just out of question in smaller classes like nurseries, pre-nursery. It will just not be possible. And therefore, whenever such a decision is taken, as Dr. Bhat also pointed out, she has given large data, epidemiological data. I think one has to think very carefully. Probably the older children, the adolescents, it may be a different ball game altogether. But for the younger children, I think one has to be very cautious because the same principles of prevention and social distancing, masking cannot be applied across the board to children of all age groups. So therefore, whatever decision we take, probably we need to stratify the decision based on the age group. That probably would be a better approach rather than an all or none, that no school should open. I mean, adolescents, 11th, 12th, that kind of a thing, probably we can think about it. But younger children, definitely we are worried because even in our cohort, it was the younger children who tended to be more sicker as compared to the older children.
Okay, okay. Now that's one scenario which you rightly explained, Professor Jayashree, in terms of the outside environment. But what needs to be done in the household environment as well? Because not everywhere the schools are reopening right now, and it is being left to the local administration, the state governments as well. They are taking their decisions based on the situation in their respective areas in terms of the COVID infection out there. But even when the children are at home. And now that they are moving out of the household, going to the parks, to play fields as well, interaction has increased. So what needs to be done there?
So I think the same principles of prevention that all of us are following, whatever can be the child can follow, and whatever we can implement for the child, like hand washing, definitely we can implement. It should start very early and it should be sustained. So I think the parents or whoever are the caregivers of the children should ensure that if the child goes out, they come back, have a good hand wash, change the clothes which they wore when they went out to the park to play with other children. And if masking is possible, a simple cloth mask, which is easy to breathe for the child, can also be ensured. And like they can carry their own, maybe if like they say they are carrying some toys to the park to play, they can carry their own toys, not to share toys. Some simple kind of measures can be taken. Obviously, it's not possible to make children remain in glass houses all the time. We have to be practical, because these are important. Such interactions, peer interactions, are an important part of the growth of the child. So therefore, we have to strike a balance. So we now that the pandemic is eased off a little in some areas, let's say the child goes out to the park under adult supervision, follows all hygiene, personal hygiene precautions, comes back, there is a good hand wash, change of clothes, sanitize whatever toys the child has taken. I think these kind of precautions will go a long way in probably minimizing the contact exposure and probably preventing the infection in children. Though I can't say that they will be 100% effective all the time, but I'm sure they will definitely help in reducing the infection.
Okay, and then definitely, we can't lower our guard out there in terms of taking preventive measures. Dr. Bhat, would you agree on, and would you like to add more here? Because as all of you are pointing out, this is one section of our society which needs to be taken care of. They are, specifically the younger children. They're highly energetic. They do want to indulge in outdoor activities as well, and it becomes sometimes difficult to implement all those preventive measures out there with the children, specifically the younger lot.
Yes, Vishal, as co-panelists have pointed out, interaction and peer interaction, social interaction is very important for a child's growth and meeting developmental milestones at right time, especially for the younger children. So keeping them in glass houses for a very long time is not practical, and it's not advisable also. So gradually we have to open up and expose our children to the world or their physical environment per se. Mm-hmm. But at the same time, taking preventive measures as far as possible, wherever is possible to the maximum level, that will help us to bring down the infection rate. At the same time, opening up of schools, it is given, the decision is given to the local administration. So taking into that consideration, northeastern states, Mizoram, they started opening up the schools, but within 2-3 days, case rate increased, and suddenly again the complete lockdown has been announced in the state. Just one small example from Northeast. So schools taking adequate measures like enough of sanitization in the schools, maintaining proper SOP maintenance, and children wearing masks and other hand washing and other personal hygiene things, that's all important. But considering the rural scenario where our school infrastructure in many of the states in rural context, school infrastructure itself is poor, where there are no toilet facilities. So it is very debatable whether the schools will be able to promote such a level of sanitization, mass sanitization, continuous monitoring. It is highly doubtable, but maybe with community participation and help of local administration, we can try to do the maximum possible things for the schools. And at the same time, another point we need to see is self-medication is increasing. For children, parents are hesitant to take the children to the hospitals and consult whether it's COVID or some other viral infection or a dengue. This is because of stigma. So we have to work on that particular aspect, that stigma is brought down or stigma is handled properly so that parents don't feel apprehensive. Now somehow a casual attitude has been introduced to the society that children are less susceptible to this disease, as well as the cases are asymptomatic and children are not severely infected. So parents are thinking, why don't we go for self-medication?
Okay.
So that is an important point we need to address, and there should be some measures to address this particular dimension. Some 2-3 cases and 2-3 studies from southern states of Kerala and Tamil Nadu are showing that parents are increasing their self-medication practice for children as far as COVID is concerned. This has to be discouraged.
Okay. That's definitely a really important point. And let me take that to Dr. Aparna Mukherjee here. Dr. Mukherjee, self-medication seemingly, and we have had this discussion on this particular show specifically for all COVID patients as well. But in case of children and specifically the younger children, this becomes really important, and things can go, southwards in a very quick manner, which might not be really helpful for the health of the child concerned.
Yes, self-medication is always a problem, particularly since winters are now coming, and in many parts of the country there will be an increase in the air pollution, and so children would be suffering from more respiratory symptoms and conditions anyways, be it COVID or be it any other virus. So if this atmosphere of stigma continues, if you don't go to a doctor because you fear that if you're diagnosed with COVID, you'll have to go through this and that should be discouraged, so that we don't really self-medicate our kids, because particularly for kids, you should be very aware that their dosage and their formulations, everything's different, and you just can't read up, you just can't Google and then give medicines to your children. You should be very, very careful about that.
Okay. So there it is. Thank you so much, Dr. Aparna Mukherjee, Professor Jayashree, as well as Dr. Lekha Bhatta, for sharing your views with us and our viewers on this very, very important topic when we talk about the battle against COVID-19 pandemic, and that is one vulnerable section of the society, children, wherein the studies have now, brought more evidence to the fore that the children are equally susceptible to the COVID-19 infection, and they can be the carriers or they can very easily transmit COVID-19 as well. The key here is to adopt all preventive measures and also to ensure that do not indulge in self-medication, as our panelists were pointing out. As far as preventive measures are concerned, 3 simple steps, as we've been pointing out time and again. Wear your mask properly and make children also wear the mask. Wash your hands regularly and make children also understand the importance of washing the hands regularly and maintaining physical distancing or social distancing of at least 6 feet. These are 3 simple steps which can go a long way in preventing us and our dear children from the infection of COVID-19 virus. We'll come back again tomorrow with a different topic. Till then, keep watching Rajya Sabha Television.